According to the Center for Disease Control, 611,105 people died of heart disease, 584,881 died of cancer each year in America, and 250,000 died because of medical mistakes. Medical errors are the third leading cause of death in the U.S. The newly calculated figure for medical errors puts this cause of death behind cancer, but ahead of respiratory disease. Let's take a look at 6 examples of the top medical errors in America. Number 6. Thomas and Nancy Andrews were having trouble getting pregnant and was told they would need in vitro fertilization to achieve pregnancy. So they went to New York Medical Services for Reproductive Medicine for their IVF procedure. During the in vitro fertilization, New York Medical Services for Reproductive Medicine added someone else's sperm to Thomas and Nancy Andrews' eggs. They had no idea until their baby was born. It was then that they noticed the baby's skin was drastically darker than the skin of the Hispanic mother and the Caucasian father. They noticed the baby had what they describe as characteristics more typical of African or African American descent. Lab results and DNA testing revealed that Thomas was not the baby's biological father. As you can imagine, this unfortunate event has caused a lot of concern for the Andrews and have left them with dozens of unanswered questions, like the couple are concerned that the baby's natural father could try to claim rights to her. They also worry that the unnamed donor's sperm may have been used in other inseminations, or that another couple may have received Thomas Andrews' sperm. There is continuing uncertainty as to whether the genetic material of either or both of them has been inappropriately harvested for others and that they could have biological children or half-children that they are unaware of. Unfortunately, the child will never know or be able to determine the identity of her actual father and will consequently never have the ability to know her complete medical history and condition.
Like, comment, subscribe.
Number 5. In Fort Worth, Texas, 55-year-old Glen Hermes had a doctor's appointment because he was having pain near his scrotum. He also noticed a growth near his right testicle. Hermes was told that the lump was at a high risk of being cancerous, and doctors recommended surgery to remove the kidney. He underwent surgery at Plaza Medical Center in Fort Worth to remove his left kidney because of cancer. The surgical team removed the left kidney after the left kidney was removed and sent to a pathologist for analysis. The pathology report indicated the kidney that had been removed was healthy. Hermes was told that his urologist and radiologist were wrong when they told him the cancer was in his left kidney and the cancer was actually in his right kidney. The cancerous section of Glen's right kidney was removed, but now Hermes is facing dialysis, a transplant, or the prospect of expensive drugs to keep him alive for the rest of his life. Glen is now suing his urologist and radiologist. He is seeking more than $1 million in damages. Number 4. An 81-year-old Binla Nayyar went to a hospital in Oakwood, Michigan, for jaw surgery to relieve pain due to temporomandibular joint disorder, basically a surgery to pop her jaw bone back into place, but the hospital staff incorrectly put her name on another patient's medical scan records. Binla was then taken to an operating room where surgeons drilled 5 holes into her brain and removed the right side of her skull before the medical staff caught the error, but by that time it was too late. The damage was done. Following the incorrect procedure, Binla was placed on life support, and she died 2 months afterwards. The hospital did not disclose the mistake to the family or to the state of Michigan, only admitting to the error 2 years later during the lawsuit proceedings. The family was awarded $21 million in damages. Number 3. On March 12, 8-year-old Andrew Sheldrick went to sleep. After his mom had given him what she believed was his normal dose of tryptophan, a medication used to help him go to sleep at night because Andrew had been diagnosed with a sleep disorder. He needed this medication in order to fall asleep. Unfortunately, the next morning when his dad went to wake him, Andrew was unresponsive. Andrew's parents rushed him to the emergency room, but it was too late. According to the doctors, there was no amount of intervention that could save him because the child had been deceased for quite a while by the time he was discovered. Andrew's parents were not aware of what caused Andrew's death for almost 5 months, but at the end of July, the coroner's investigation determined Andrew had not taken tryptophan, the sleep medication he'd been prescribed by his doctor, but instead had been given baclofen, a drug used to treat pain and certain types of muscle stiffness and tightness from multiple sclerosis, spinal cord injuries, or other spinal cord diseases. According to the official coroner's report, Andrew had approximately 3 times the amount of baclofen in his system that it would take to kill an adult, and no trace of the sleep drug tryptophan. The report also determined that the pharmacy had made a mistake and substituted the baclofen for the tryptophan. Andrew died after only consuming 1 dose of the baclofen. Analysis of the tryptophan medication that Andrew was prescribed for parasomnia from a compounding pharmacy revealed that it contained approximately 135 milligrams of baclofen and no trace of tryptophan. This would be consistent with the pharmacy mixing the amount of powder that would generate 150 milligrams concentration of tryptophan, but substituting baclofen powder. According to Andrew's mother, the family had no indication there was a problem with the medication. The liquid that was in the bottle, it looked the same as Andrew's medication, and he didn't say that it tasted any different, Sheldrick said. Unfortunately, there was no way of knowing that it was anything different than what he was supposed to have. The family's lawyer filed a lawsuit on their behalf against Floridale Medical Pharmacy Limited, and Amit Shah, its owner and manager, are named in a multi-million-dollar lawsuit.
88-year-old Ila Vitter Massiel suffered a stroke that paralyzed the left side of her body. While at the Santa Casa de Barra Hospital, a nursing technician injected soup into Ilda's IV in her right arm instead of her feeding tube. Massiel's daughter, Anna Ruth, was with her when the injection happened and recalled her mother began to squirm in discomfort and stick her tongue out as soon as the soup was injected. She reported she had not seen her mother that physically distraught since being in the hospital. Ilda died only 12 hours after receiving the injection. The director of the hospital acknowledged the error, but does not believe it is related to the patient's death. The family is now filing a lawsuit against the hospital.
Number 1. Patients placed under general anesthesia during surgery usually receive 2 forms of anesthesia. The first is a paralytic to stop movement and inhalation anesthesia to eliminate pain and induce a loss of consciousness. Sherman Sizemore underwent surgery. While the first medication, the paralytic, was properly administered, the second one was not, which caused Sherman to be awake throughout the surgery. He could feel everything, but because the first, paralytic medication was administered correctly, he was paralyzed and could not move or speak. After nearly a half hour into the surgery, the surgical team finally realized the patient was fully awake. The hospital never informed him of this mistake. Instead, they gave him an amnesia-inducing drug once they recognized the mistake. He knew something was wrong, even though he was unable to recall precisely what happened. Sizemore never had any psychiatric or psychological conditions, but now he suffered from panic attacks and thought that people were trying to bury him alive. He also suffered insomnia and nightmares. A few weeks after the surgery, he committed suicide. His suicide is believed to have been caused by his symptoms of anesthetic awareness, which affects an estimated 20,000 to 40,000 patients every year. Mr. Sizemore's family sued Raleigh Anesthesia Associates in West Virginia for failing to properly anesthetize him, which they believe caused their father to kill himself. The case was settled confidentially.
Like, comment, subscribe.